So I mean, it's really clear that you can set something up with good intentions, but that's more than that, isn't it? It's kind of you're in touch with something that is beyond just good intentions, and there's something in that you're just able to trust. So tell us a bit now about like the actual process of setting it up, because well, I know there would be a lot of challenges and a lot of complications, so just tell us a bit about that.
Okay. So we started off setting up the outreach teams, the community team, without any buildings. So as a way, partly because we were both working part-time, Paul was working full-time in his job, whilst I was beginning to set up the outreach team, because it's less complicated than a whole rehab centre, because that's a whole building project as well. So, and also we had to generate some money to be able to do that. So we're setting up the whole organisation, the culture through the outreach team. So, and Paul and I were doing support shifts with us, and somebody else actually, another Buddhist actually at the time. So we had a very small team where we were setting everything up and going and doing support. So it's kind of, you're doing everything when you're setting up your own business. I think unless you've done it, you don't understand what it's like.
This is what I have heard.
Yes, everyone just thinks it looks quite easy because they see it when it's all successful, but they don't actually quite know what's the cogs which are going in the background. So you are literally everything. You're suddenly the HR department, you're doing recruitment, you're the website, you're actually doing the shifts. So it's very complicated in that sense. So we had set up the outreach team, and then Paul's like, oh, I found a building at auction, and he's going to auction on Tuesday. I didn't even get a chance to look around it. I looked through the windows. 3 swans flew overhead, and I was like, oh, that's a good sign. It was like literally kind of, okay, I'm just going to have to trust this process. Maybe that's Avalokitesvara, maybe it's a bit of a sign. But it just felt like, okay, let's go with this. We had this beautiful old derelict building, which is full of dry rot and pigeons. And yes, we were like, actually, we're going to transform this into a transitional rehab service, our first rehab service.
And it's such a leap, isn't it? Because like, what do you do about money, for instance?
Well, we literally sold everything. So we remortgaged the house. We sold everything that we didn't need to have. And we did get bank funding. Originally we got bank funding. We bought the building, and then that bank decided they were going to change their funding kind of scheme, and they wouldn't fund healthcare projects for some reason. And so we're suddenly left with that bank and a very mouldy building where we were just like, okay. So we did eventually get bank funding for somebody else, but it's still quite a process, because you're literally signing away everything you own. So you have this whole process of all this paperwork, which basically says if it goes wrong, then we take your house and your livelihood and everything, all your savings. And so that's why it takes a level of courage to do these things, because there's a lot at stake. For me, obviously, I was a bit like, sorry, Avalokitesvara just told me to do this project. So
what's Paul like? Because Paul's not a Buddhist, is he?
No, so
did you say to Paul, oh, Avalokitesvara's told
me
me
to
do
this,
this,
so fine. And he'll be a bit like, yes, just like rolling his eyes, going, it'll be fine if we get the bank funding. But I think, so I mean, on some level, it's interesting, because on some level, I think he sort of slightly trusts it, but not going to say. But we also knew we could do a good job. So it wasn't based on we'd never done this before. We had developed services elsewhere. And for myself, with this sort of risk analysis in my head, how I work with things which are scary and got a risk, I think, well, what's the worst case scenario? And the worst case scenario in this country, we're in a very blessed situation, aren't we? The chances of us going hungry and dying is fairly slim, because we've got somebody's going to look out for us. So we should have more courage, I think, in the things that we do, but the worst case scenario, we'll lose everything. We'll lose our beautiful home, which we've spent all these years building up to having, and maybe we rent a flat above a chip shop, and Paul goes back to nursing, I go back to health and social care management. We've got a bit of egg on our face, looking a bit stupid, but that's the worst case scenario. And you're sort of weighing that up then with, well, we've got the possibility here, we've got the resources to be able to do something which could really make a difference to people. And there's a gap in this, people being at hospital and going back home and having proper therapeutic work so that they can develop their skills, begin to reteach people to speak, their dexterity in function, which they have to rehabilitate actually in proper environments. Our services have their own flats and a really high quality team. We have a strong psychological environment. So I've seen other places where they might have stopped people walking again, but their inside was still a bit broken. Their sense of self-purpose and their positive sense of self was not there. So we build these services up to kind of so that can shift so people, they're back in the driving seat of their own life. They can go back out into the world. Change might still have some difficulties, but have a positive sense of self, and they can get on with their lives. That's our job. So we knew we wanted to do this piece of this work because there wasn't really these kind of services. So the other thing which was tricky is that people would say, yes, nice idea, but nobody's going to commission them. So and actually once we'd bought the first service,
so just say what you mean by commission, because it's like how things get funded.
Yes. So somebody's got to pay for people being in the rehab services, and in our type of rehab service, generally speaking, that's normally people have a rehab budget from the NHS. Sort of individual will in the hospital, they'll say this person needs to have more rehab, and we'll pay for it. Or if people are dropped down to, but the problem is people fall between that and social services, local authority funding, where you're in the community, so you're not in hospital stuff, so actually you should be funded by social services, and they've not really got much money at all. The problem when you're looking to develop a service is you go to the the local authorities, social services, and they say, oh, that's rehab, so you need to speak to the NHS. The NHS say, oh, that's in the community, you need to speak to local authority, so nobody will speak to you about it, and actually, so nobody's really, you can kind of go, yeah, good idea, but who's going to fund it? And I literally had 3 people who said, great idea, but nobody's going to fund it. I didn't tell Paul. We're going back to what Paul thinks about things. I thought, no, he's got enough stress. So I'll just, because I think, no, there's this need for these services. And so we kind of just kept moving forward with it.
And so was it like, you just, in a sense, you had to go out kind of selling, and you just had to kind of say, look, we're doing this service, and then you just keep on approaching people? You know, beyond the 3 people that said, oh no, it's not going to work.
Didn't get back to them. But yes, I mean, we know what we're talking about, and you tend to go to places and they're like, yeah, and what happens to start with is they tend to put people with you which they can't place anywhere else. Because so you tend to get all the really tricky people to start with, because they've tried everywhere else and it's not worked. And you've just got to sort of prove yourself on those people. And then after a while, they see the work that you do, and you just get repeat people coming through. So like now we're sort of one of the default people would place for rehab, because the outcomes are really good. So from an NHS point of view, if they send someone from us, you're unblocking the beds in the hospital. It's a lot cheaper than being in hospital. And then actually if we reduce people's care dependency, then actually in the long term, we have people leaving our services and needing no support.
So then the social care doesn't have to pay for it because they don't need it.
No, exactly. So that's sort of how
Great. So just going back to the kind of difficulty and stress of setting it up, like, was there ever a moment where you just thought, oh my God, this isn't going to work?
I think there's a few hairy times. Paul would definitely say there were a few times where he thought it was really not going to work. He used to have this phrase.
He's not backed by Avalokitesvara.
No, well he is, but he doesn't realise it. We're all backed. But, I always knew it was going to work. how it would unfold, you just don't know. But there were like I said, there were some times that we were doing the build and suddenly we needed another 50k, which we really didn't have because we'd sold everything. And it's times like that which were quite intense. But because for me, because I'd had blessing of this vision, in a sense, I knew it was going to work because I've got the ultimate backing, haven't I? So Paul always said I'm glass half full, he's glass half empty. So between us, we do okay. But yes, I mean, there are difficult times. It's easy to kind of look back on it and sort of look at the success, but actually it was really difficult. We were living in it for the first 6 months of opening. One of us was living in the service. We were living in it a bit whilst it was getting built as well. And it was intense. You're there all the time, and it's very much an immersive situation where you're leading the team and you're showing them what to do. And yeah, it's tough. It's a tough starting point, but you're doing it for the greater good. And when you see people develop, it's just, and they just get better. It's just the best thing in the world. You know, get somebody and they're beginning to see their potential. They're beginning to see that in themselves, and they're beginning to walk and speak. It's just magical. So worth every difficulty.
So tell me a bit about what practice looks like in those conditions, because obviously, you know, one can have an idea of practice where, you know, one needs lots of space in your life, and you know, you can work part-time and stuff like that, whereas you've taken a route that's completely different to that. So what did practice look like under those conditions?
I just find that interesting. People often talk about doing less work so they can practice, and for me, my practice was my work. You know, so I always find that really interesting, and for me it's been massively transformative. So it changed because in health and social care you're often working different sort of shifts as well, and I originally started off very earnestly with my nice 50-minute meditation and some reflection practice, and actually reading something afterwards, and that was nice and blown out the window. So I became a master of the finding the gaps, I think, really, and I'd often do the meditation in the car because there's a clear space where people aren't going to interrupt me. So it came to, and even in the small times, really taking the preciousness of those small times. And if you get a chance to hearing your teaching, it's really absorbing it. In some ways, I think it makes you value it more because you've got these shorter times for things.
In a way, it sounds like you've really got to bring a focus to that, where you know, okay, I've got this 15 minutes when I'm in the car, I'm going from here to there, or whatever it is. And so your attention is completely there.
Because that's your opportunity.
That's your opportunity, yeah.
You might be going in the lift.
Yeah.
I'll take the lift and have a mindful lift you. So yeah, so it's sort of and just really bringing your practice. It's really holding people in metta. You know, each person you're meeting is such I'm doing the practice on the way into work, and imagine the people that are going to be there. You know, so it's just you can find a way. You know, you have to be adaptable, I think. So yeah, it's always good to just be able to have a nice sit or come on retreat, but you know, sometimes that's just not what life's like, isn't it?
It was something that I think you told me about before, about how you'd almost got to the state where you'd just sit in the car and go into dhyana because the conditions were the car.
It's like my mind associated the car with dhyana, so it's just a bit like, okay, well, this is amazing. It's very good for one's road rage. So,
I bet.
Yeah, or lack of it, really. So yeah.
Great. So could you just tell us a bit now about, so what date when did you start Ariya, what year, and what's it like now?
So we started in 2015, and then, gosh, it's sort of 10 years of evolution, really. So we've developed the first service, and then we, because despite what the naysayers said, there was a need. We were getting a waiting list, so we developed another service. The first one's in Rotherham, next one in Barnsley. That one opened just a week before the first lockdown in COVID, so that was a whole, when you're going back to certain challenges. That was an interesting time. Had 2 families locked in, all the people emptied out the hospitals. Yes, we had people. I think people forget actually what that was like. We had a memo coming round for from CQC where they said, "Do your
What's CQC?
Oh, sorry, the Care Quality Commission." So they kind of it's like Ofsted for health and social care, and they basically sent a memo around saying, "We're not coming out, but do your very best to preserve life," is what they sent out to us. So it's just quite ominous, really, when you've got this horrendous virus coming over. So that was quite an intense time. But I think the kindness culture really, and the quality and the kindness within the staff team. My staff team said, "Well, we're not going anywhere. This is our job, and this is what we're here to do." So that was incredible. Despite you literally had a nurse phoning you up every day saying, "Has anyone died?" You had to work all the desk nurse. So it's kind of quite a practice. So that was the second service, but it's amazing. Then we developed another service in Chesterfield, so another service, and all the inspected services are CQC outstanding in all 5 areas, which is, anyone who knows how difficult it is to get these ratings, it's virtually impossible. So to kind of get that high level of rating is testament really to the quality and the kindness that's really imbued.
Is that the rating that's called platinum?
No, the platinum rating is the invested in people, so that's slightly different. So CQC are like the Ofsted of health and social care, so they inspect dentists and surgeries and care homes.
Okay, so they're inspecting your services from the point of view of the patients and kind of assessing, well, what is this service? Is this service any good in all these different areas?
Yes. So they'll do it on whether it's safe, well led, whether it's caring, whether it's effective. Those kind of things. So they'll be looking for that, and then you get good or requires improvement or etc. or outstanding if you've got outstanding in practice. So to get it in all those areas.
And you just got outstanding in all the areas?
All areas.
All areas.
So
wow.
In all of the services you've got. So we might be the top rated organisation in the UK. I haven't checked recently, so I can't say, but there was a period of time we certainly were, because having all the services. So it's really unusual. It's only like sort of 36 other services in the UK have that rating. We've got it in all 3. So so that's the CQC. And then we also, in COVID, because CQC weren't coming out, we did the Investors in People accreditation. So they're not just health and social care, they're any charity or business who wants to put forward. So they're measuring the workplace culture effectively. So it's more the staff side. So we thought we'd do this because, I don't know, gluttons for punishment in the middle of COVID, because we weren't being inspected. We wanted to kind of make sure a different benchmark really for our quality. And they came out and they do an anonymous survey across all your staff and interviewed about 37 people and come out and see you. And we got platinum, which is the highest rating on entry level, which they said it was impossible. The assessor said, you just don't do that, and we did it. But it's because of the culture. It's the workplace culture. It's because it's a kindness culture. It's like the mini Taraloka on that retreat is going imbued across the services.
I mean, I think what's so amazing about this is you're just showing how effective dharmic values are when you actually put them into practice. And they're not just effective because they're effective. It's like they're actually being seen as effective by all these secular organisations that are trying to assess how good services are, how to look after people, and they're actually looking at this and saying, you're off the scale.
And there's the outcome, so we can say, "Oh, it's really lovely."
Yeah.
But actually, other people are seeing it and seeing it's really effective in different levels.
Yeah.
But the kindness culture it's dharmic, but it's also human. So metta's everybody's
human.
Yes, it's human. It's not just a Buddhist thing.
No. And you know, from you taking that example of the 30 women on retreat, they can all become kinder. And then you're taking all these employees and giving them the conditions and the culture where they can become kinder. And then these are the outcomes.
Because it's fundamental. It's natural to people. So you'd asked me earlier if there's conflicts or if it was difficult, and in some ways setting up the kindness culture, there was no conflict because it's actually our natural way of being. So that's sort of, there wasn't the conflict in that sense. And actually people respond to it. They love to be working. I get these compliments back from the staff that's saying, you said it was going to be really good and everyone was really lovely, and I thought, maybe, yes, whatever, you're going to say that, aren't you? But actually they're saying, actually they are all really lovely. So I get these emails back going, you were right. You know, that's just magical. What people want to be in that they want to work in a place where people are looking out for each other. They're not having to watch their backs all the time. They can properly flourish in it. So, you know, the majority of people want to be in that environment.
And so what happens if you you know, you're doing your best to pick employees that are aligned with those values, but what happens if you get somebody and actually they're just not? Like, what do you do in that